10 excellent exercises for knee health, focusing on strengthening the supporting muscles like the quadriceps, hamstrings, and glutes, and improving flexibility. Important disclaimer: always consult with a doctor or physical therapist before starting a new exercise program, especially if you have an existing knee injury or pain. Stop immediately if you feel any sharp pain. The golden rule: focus on form. For all these exercises, proper form is more important than the number of repetitions. Move slowly and deliberately. Exercises for strengthening. 1. Straight leg raises. Targets: quadriceps, front of thigh, hip flexors. How to do it: lie on your back with one leg bent, foot flat on the floor, and the other leg straight. Tighten the thigh muscle of your straight leg and slowly lift it until it's about a foot off the ground, keeping your knees straight. Hold for 3 to 5 seconds, then slowly lower. Reps: 10 to 15 repetitions on each leg. Why it's good: builds quad strength without putting weight directly on the knee joint. 2. Hamstring curls. Targets: hamstrings, back of thigh. How to do it: stand, holding onto a chair or wall for balance. Slowly bend one knee, bringing your heel up toward your glute. Don't let your knees swing forward. Keep your thighs parallel. Hold for a second, then slowly lower your foot. Reps: 10 to 15 repetitions on each leg. Why it's good: strengthening the hamstrings provides crucial stability for the knee joint. 3. Glute bridges. Targets: glutes and hamstrings. How to do it: lie on your back with your knees bent, feet flat on the floor, hip width apart. Squeeze your glutes and lift your hips off the floor until your body forms a straight line from your shoulders to your knees. Hold for a few seconds, then lower slowly. Reps: 10 to 15 repetitions. Why it's good: strong glutes prevent your knee from collapsing inward, a common cause of pain. 4. Wall sits. Targets: quadriceps, glutes. How to do it: stand with your back against a wall. Walk your feet about 2 feet away from the wall, keeping them shoulder-width apart. Slowly slide your back down the wall until you are in a seated position with your knees bent at a 90-degree angle or a less acute angle if that's too much. Ensure your knees are directly above your ankles, not over your toes. Hold. Hold time: start with 20 to 30 seconds, work up to a minute. Why it's good: builds incredible isometric strength in the quads, which are the primary stabilizers of the knee. 5. Calf raises. Targets: calves. How to do it: stand holding onto a chair or wall for balance. Slowly raise up onto your toes, lifting your heels as high as you can. Pause at the top, then slowly lower your heels back to the floor. Reps: 15 to 20 repetitions. Why it's good: strong calves help with shock absorption when you walk or run, reducing impact on the knees. 6. Clamshells. Targets: gluteus medius, side hip muscles. How to do it: lie on your side with your hips and knees bent at a 45-degree angle with your legs stacked. Keeping your feet together, lift your top knee as high as you can without rocking your pelvis back. Pause, then slowly lower. Reps: 15 to 20 repetitions on each side. Why it's good: this is one of the best exercises to prevent knee valgus, knock knees, a major source of knee pain. Exercises for mobility and stretching. 7. Heel slides. Targets: knee range of motion. How to do it: lie on your back with your legs straight. Slowly slide the heel of one foot towards your glute, bending the knee as far as you comfortably can. You can use a strap or towel around your foot to gently assist. Slide the heel back out to straighten. Reps: 10 to 15 repetitions on each leg. Why it's good: gently restores bending and straightening in the knee joint. 8. Quad stretch. Targets: quadriceps. How to do it: stand, holding onto a chair for balance. Bend one knee and grab your ankle, gently pulling your heel toward your glute. Keep your knees together and your torso straight, don't lean forward. You should feel a stretch in the front of your thigh. Hold time: 20 to 30 seconds on each leg. Why it's good: relieves tightness in the quads, which can pull on the kneecap. 9. Hamstring stretch. Targets: hamstrings. How to do it: sit on the floor with one leg straight out in front of you and the other bent with your foot against your inner thigh. Gently hinge forward your hips, not your lower back, over the straight leg until you feel a stretch in the back of your thigh. Hold time, 20 to 30 seconds on each leg. Why it's good: tight hamstrings can alter your gait and put stress on the knee. 10. IT band stretch. Targets: iliotibial, IT band. How to do it: stand and cross your right leg behind your left. Lean your torso to the left, pushing your right hip out to the side. You can raise your right arm overhead for a deeper stretch. You should feel it along the outside of your right hip and thigh. Hold time, 20 to 30 seconds on each side. Why it's good: a tight IT band is a very common cause of pain on the outside of the knee, IT band syndrome. Sample routine. For strength, 3 to 4 times per week: 1, 2, 3, 4, 5, 6. For mobility, daily: 7, 8, 9, 10. Start with 1 set of each and gradually build up to 2 or 3 sets as you get stronger. Consistency is key for long-term knee health.